Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. High monocytes blood test result. A high monocyte count, monocytosis, is a blood test finding that can indicate an infection, an autoimmune disease, or a blood disorder. High monocytes can also be a side effect of medication. /r/n/r/n monocytes are white blood cells, part of the immune system that helps fight infections and diseases. There are no symptoms of high monocytes. Monocytosis doesn't cause health problems but is an indication of an illness or underlying condition, which could be minor or serious. /r/n/r/nSEBASTIAN KAULITZKISCIENCE Photo Library, Getty Images /r/n/r/n. If your blood test identifies a high monocyte count, or monocytosis, it could mean a few different things. Monocytosis happens when your bone marrow is producing too many monocytes, a type of white blood cell. These help your body identify and fight infection from viruses, bacteria, and other microbes. /r/n/r/n monocytosis can be temporary, like when the body needs more monocytes to fight a bacterial or viral infection. Long-term overproduction of monocytes, however, may indicate a chronic health condition. /r/n/r/n high monocyte levels are associated with /r/n/r/n physical, emotional, or mental stress can temporarily increase monocyte levels. Even exercise or a poor night's sleep can raise monocytes. When you are under chronic stress, prolonged high monocyte levels can occur. /r/n/r/n elevated monocytes are also found in mental health conditions, including depression. Research suggests specific monocytes may be useful biomarkers for identifying people with depression at risk of suicide. /r/n/r/n Since high monocytes do not cause any symptoms, the only way to know they are imbalanced is with a blood test. /r/n/r/n monocytes are assessed using a complete blood count, CBC, with differential. This blood test measures blood cells and provides a detailed breakdown of the number and proportion of different types. /r/n/r/n monocytes are measured in cubic millimeters, m3, and a percentage of white blood cells. While normal values can vary by lab, the reference range is commonly as follows: /r/n/r/n high monocyte levels that last longer than 3 months are considered persistent and warrant further testing. /r/n/r/n Your healthcare provider will assess your monocyte number in context with the other CBC results. Some issues that cause monocytosis will cause other numbers to be off, giving clues to the cause. /r/n/r/n To help pinpoint a cause, your healthcare provider may order additional diagnostic tests, such as /r/n/r/n treatment for monocytosis depends on the cause. For example, antibiotics are prescribed to treat a bacterial infection. People with leukemia, cancers of the blood, may be treated with chemotherapy or other cancer treatments. /r/n/r/n Sometimes, a related condition may need to be treated as well. For example, anemia may need to be treated with therapies such as a blood transfusion or erythropoietin, a hormone that stimulates red blood cell production. /r/n/r/n During treatment, you may need to have your monocyte levels checked repeatedly. Testing at regular intervals helps to monitor the effectiveness of treatment. For some types of leukemia, all blood cells are periodically monitored to determine the effects of treatment. /r/n/r/n High monocytes are a sign your immune system is hard at work. You can help prevent monocytosis by following healthy lifestyle tips. /r/n/r/n Monocytes are a type of white blood cell that play a role in your immune system. Monocytosis, a high monocyte count, can occur along with changes in other leukocytes, white blood cells, or it may be the only indication of a medical problem. /r/n/r/n. Common causes of a high monocyte count include infections, leukemia, and autoimmune diseases like rheumatoid arthritis, lupus, and ulcerative colitis. /r/n/r/n. If you have a high monocyte count, you may need diagnostic testing to determine the cause. You also may need treatment for any underlying medical illness that is causing monocytosis. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.